So with David Ashford still with us, so we have our questions, which are diminishing yet more, Minister. But this is quite interesting to start with. Can the government clarify if people travelling from the UK or Channel Islands competing in the parish walk after 7 days isolation, for example, the post of 7 days restrictions are so vague, but all involve an internal setting such as restaurants and bars? I know of a few people, myself included, who would like to travel back for this event but don't want to get into any trouble.
Well, firstly, I'm not certain if the parish walk's going ahead this year or not. I haven't following it. I haven't been following it. I haven't heard any announcements saying it's not.
Yeah, let's say it is.
But I do need to clarify that because I must be honest, I haven't been following those
it's
announcements.
Not your thing. You've got other things to be
doing.
I
think people looking at me can probably tell I haven't done the parish walk that often, Paul, or at all, in fact. But no, so caveating it and saying, assuming it is going ahead, there would be nothing to prevent people taking part in outside settings. Obviously, the restrictions after the 7 days apply to indoor settings such as health and so on, but I'm not aware of anything that would restrict them going out in that way, because they're outside, they're in an open environment, and they can socially distance from people if required.
Okay. Could I ask you about the current situation with the island regarding long COVID sufferers, and how many deaths have there been attributed to damage of symptoms following being ill with COVID? This question immediately follows the death of a person after a long fight. He passed away in ICU, and just obviously the interest on this long COVID.
Yeah, in terms of long COVID, we do need to be careful about associating COVID with people dying afterwards. That is a decision made by the medical examiners as to the cause of death. It's very difficult to do because you might have someone who's got a serious condition that they're not going to recover from anyway, who then develops COVID and then recovers from COVID but still dies of the serious condition. So it can get very, very subjective in that regard. So there isn't any official figures as to how many people that would be, because it would go off death certificates. And if the death certificate is due to someone else's condition, it's very subjective to say that if they hadn't had COVID, would they have still survived
we'll never know
afterwards?
The actual numbers.
So we will never know those kind of numbers. Those kind of numbers won't even be kept in the UK. The UK measure is someone dying within 28 days of 14 days with a positive
Is that different
result.
from flu, though? When people
No, it's exactly the same. COVID is treated no differently in that respect. If someone had flu with an underlying health condition, recovered and died of the underlying health condition, it wouldn't be put down to them dying from flu.
Actually, I need to ask, how are we doing at Abbotswood? Is that still under the
so it's still
court
police
system? We can't talk about it?
Yeah, as far as I'm aware, police investigations are ongoing. As Minister, I wouldn't be involved in that because it's a criminal matter.
But when it's done and dusted, then you think you'll be back in front of various committees about that?
Quite possibly. The committees obviously pause, quite rightly, parliamentary committees pause any investigation while a criminal investigation's ongoing, a police investigation. Once that's concluded, then they may well decide to pick it up again.
I mean, you must have taken an interest in what went down there, because you know.
Yeah, I mean, obviously,
the ins and outs.
I knew the ins and outs, but I can't discuss while a police investigation is ongoing.
Okay, why are the government covering up and stating no reports of positive COVID on Friday, yesterday, this is obviously last week, when at least one positive case before 4 p.m? I get this every day, I'm sure you do. No COVID announcements. Don't use the excuse of snapshots, as this case was known. And it goes on to be a bit more detailed about where it was and that sort of thing. But
as soon as we have a positive case, it is reported into the figures. Now, the person doesn't want me to mention snapshots, but there is a reporting deadline. To save confusion, because this is where the figures used to get very, very confused, because what happens is there was a snapshot done, say, at 11 o'clock, then another snapshot at 3, another snapshot at 4, because something's come out of the lab, and then suddenly so everyone's got a mix of all figures. So the snapshot might be done at 8 a.m. on a Friday. If that was done at 8 a.m. on a Friday and a case was identified by the lab at 1 p.m. on the Friday, it wouldn't actually be reported until the Saturday. So there's no covering up of figures. The figures will be announced, but there may be.
And this is last Friday, so nothing did come up.
But then no.
So that was just a rumour.
Yeah, there was no. If the number is 0, the number is 0. Yeah. We've always announced every case that we've ever had identified.
This goes on all the time. You get it, I'm sure, as well.
Yes, I do. And, when it's investigated, even when people have given individual cases, it's turned out not to be the case, that anything is untoward or wrong.
Let me just finally ask about this potential booster jab. I think we touched on it last time we were talking, but any more updates? Because there could be one in June, maybe end of the year, if we follow.
Towards the end of the year.
Is that still likely?
The UK will be going
whatever they do,
to
we
boosters,
do.
and we will. The UK has kindly stated that yet again we will have access to their supply on the same basis as we do with the main vaccine, which is 0.15%.
And this won't be in the big COVID centres for injections. It will be just GPs, will it?
Well, we'll decide upon that because we still need to know the details around the injection. That would depend upon the licensing. Authorisation to deliver, who's actually authorised to deliver it. So it may be via the vaccination centres because they have been proven to show they can get large volumes of people through very fast and be done in a very efficient and quick way. So we may decide to go down that route, we may look at alternative routes, but we need that information around the jab, how it works in practice before we can make that decision.
And how's your stock? And are we on schedule?
We are on schedule. In fact, we're slightly ahead of where we were expecting to be at this stage. As I say, very encouraging. 80% of the adult population now vaccinated, or 81% I think it's actually at, and just over 70% of the entire population. So I think that makes us about fourth in the world currently as of today for our vaccine rollout programme.
That's better than the chance of going back to the moon. We're only fifth on that list, weren't we? At one stage. Fourth is that's fourth.
Fourth. We certainly were as of yesterday, and I think we are as of today as well. So the staff have done an absolutely marvellous job. The challenges of bringing a mass vaccination programme online for the entire population at very, very short notice. With at short notice, knowing how what has to be done around the jab as well. It's not just a case of putting in arms. There's the defrosting, the holding of the trays, the security around that. There's even protocols around the disposal of the boxes it comes in.
I heard all that, and because the little glass things, because otherwise,
vials,
if they got hold of, someone could make dummy vaccines and flog it off. So you have to dispose those
and the boxes that
and
they
the boxes
arrive in as well. There's very strict protocols. So the staff have done an absolutely amazing job. I couldn't be prouder of the way they've worked within DHSC to deliver this, and it's getting out there and it's working.
And I'll allow you the platform just to, for those doubters, and you've had hundreds who did turn down their jab. The same message, I'm sure it is, but go ahead.
Yeah, the same message again is the risks from COVID are much greater than the risks from vaccination, and people need to contextualise that. Between myself and the Chief Minister, when people see us at the podium, we've had both jabs. I had the Pfizer because that was what was available at the time, and the Chief Minister had the AstraZeneca because that was what was available at the time. So between us, we've had both. We're both fine, still here today. But like I say, people need to balance risk, and if you speak to people who have had COVID and have suffered the effects of COVID, then they would, I think, most definitely tell you that it is much better to be vaccinated than not.